that there are a lot of good doctors who were not allowed to come to the state of Mississippi. And they finished very, very fine schools. University of Connecticut for one, University of Buffalo for another one, University of Minnesota for another, but they couldn't pass Mississippi boards. And, it was, and back then we knew it was merely by the color of their skin why they couldn't pass. So they put in those laws that kind of, in the Practice Act here, that kind of stopped a lot of good doctors. And I know personally, these three guys who finished those schools would have been practicing in the Delta. Now, when Pew and Kellogg and all these people go and talking about where we got problems in Mississippi, these underserved areas, they're talking about the Mississippi Delta primarily. And that's where that's what they hold, I guess, in a way, the tenderheartedness they trying to get them into the state of Mississippi by putting them in, they say, in those areas there, which we all know, I mean, that they can do what they want to do once it happens. But and my argument is about this, that if they had allowed those guys back in those days to practice in Mississippi, we wouldn't be talking about this right now, because you would have dentists in those areas there, because that was their hometown back in those days there. And then instead, they have gone on to other states and have very successful practice and doing very well. But so Mississippi denied, some Mississippi-born dentists the opportunity to come to the state. What I am suggesting here that we form a committee to deal with the Dental Practice Act. Let's go in, clean it up, and do what we got to do. And then as we move forward, bring it back to the board. Now, Dr. Scarborough, you and Dr. Donald mentioned about our lobbyists. I mean, we got some damn good lobbyists. They keep our nose open, and so we're talking about kicking it across the street now. And I know for a fact, I mean, with the Mississippi Dental Association, Mississippi Dental Society, and the Academy of General Dentistry, and all those people that we can watch and do what we want to with this act when the time comes after we have approved it as a board, and make this thing where what we don't want, we don't get, and watch that chairman, because we know these guys. I mean, and they have been good to us over there, and that's why, like you said, you was able last year to stop what happened, when the therapists try to come in, because like I said, they always ask me, what's a simple extraction? And I tell you, and my quote is, I tell you when I finish. Because I mean, we don't know what a simple extraction is and what this procedure, and you said these people don't go out there and do that. And so my whole argument about this is that we need to look at this. You remember back in the 90s, the dentures was an issue with us. But they was able to go in and, when they opened up the last time, that was the hot, we don't dentures, this is, we can't do it, Some of you who know about it, I know you remember those days, the dentures. So, but they went in and they made some changes to that law, and they were able to keep those dentures out because what we didn't want and everything. So I'm saying we're smart enough, we got more power, we got more everything today to deal with some of the issues that will make that Practice Act be what we want it to 2018, 19, or 20 as we move forward and clean up some of that stuff that has hurt us, the dentists of the state of Mississippi, for the last whatever number of years it's been. So this is what I'm proposing to you, Mr. President. That let's get a committee. Let's go ahead and look at it. And it might take us 6 months, might take a year, I don't know. But let's go back in here and look at this Dental Practice Act, and let's go ahead and act on it, and let's go ahead and make it what we want. And we use our power, our clout, and our lobbyists to get it through there, open and closed, and let it go. Thank you.
Is that a form of a motion?
Yes, it is.
Is there a second to that motion?
Is that something I could second, or?
I think you're board member, you should be.
I wanted to say amen to that.
And it also requires some stuff that you're talking about, putting it in there.
Exactly right.
That's a second. Further discussion to send that to a committee, a disposal committee?
The only question I have, I'm not exactly sure, maybe you will explain this later, exactly what you want to address.
There are things in there. Yeah, I mean, I just want, when I start seeing little tweaks here and tweaks there, then particularly with, like I said, I know we're talking about what I came probably to my mind was 73-9 for the 4 words avenue for license. You got a person failed the board by those old guys there because of the color of their skin. Back in the old day, they're not allowed to get licensed in Mississippi today. They know all this stuff there. So that's what I'm saying. They fine now, but I'm saying stuff like that need to be taken out of that. Deleted from that section. Right now, we recognize reciprocity. You can get your license 5 years from this and this and that. But I'm saying, sir, there's an item like that is there that I'm thinking. We know why that was put there. I know why I put that there, you know. But I'm just saying that I just think that it's there. As you read the whole act, I'm not saying probably 90% of it is going to be germane. 90% of it. But there are some things in there I feel are not germane to the way we do dentistry and the way we're doing things today in the state of Mississippi. And we just need to just fix it and get some of that stuff trashed out. There are laws for the state of Mississippi on the books that the legislators won't take off and all that stuff there. And we know, they just ignoring them and just kicking it down the road and just letting it go. And one of these days, some of them will come back and hunt some people. Just like, it's going to come back and hunt the state of Mississippi, that cloud that occurs over this state. I'm not the big bad wolf. I know everybody knows what I'm talking about. But there are laws on the state of Mississippi that we know don't even nowhere near be what it is like in Mississippi today. But they're like that. So I'm just saying some of those laws, that we got in this act here. I don't know what they all are, because I scanned it, but I haven't read the entire thing line for line for line, but 90% of it probably be fine.
So one thing I would like to say, just to be sure that everybody is aware of this, maybe there was discrimination in the past, but today there is absolutely no discrimination. When somebody comes in for us to grade them, we have no idea who did that procedure.
Right.
We don't know anything about it. There's 3 people that grade them, and you don't know who did it. So
I agree with that 100%, and as a matter of fact, I had it in my notes, so I just let that go. I feel this board today is very fair. Anyone that comes along trying to get licensed in the state of Mississippi, I have no problem at all with that. But like I said, but when I saw some things in it, I said, wow, this thing here needs to be cleaned up a little bit. I'm just saying we need to be toward to clean up and open up and put back. And then, like I said, plus Mississippi Dental Society has a law that we've been trying for 20 years to get fixed. The board has written the law. It wrote it before we got on the board. Diane had it, I have it, copies of it, I don't know something. But we came, and everybody agree with it. I haven't seen no one come to me and tell me that they don't agree with that law. But about the large positions on this board. The large positions on this board and all other stuff there. The board about 15 years ago rewrote it, that board. Board of Dental Services. But it takes the Dental Practice Act to put it into the law. But because of all the things going on, they decided not to do it, and they're not to do it. So we have let that thing just sit there. it's already ready to go, and boom, and put it in law as we speak right now. And I think I've addressed that over how many times with the Board of Trustees for the MDA and all this other stuff. But I've been patient with it.
Can I add too? I remember from my last term on here 10 years ago that Diane had things that she needed cleaned up on investigations and stuff. There were some things, and we never could get the board to revisit that Dental Practice Act. So there is some bad language in it.
With that being said, can we go ahead and set the committee? Any part of that motion?
Yes, I would like to so move.
So can we we're looking at 4 people? Do we have 4 people now
Do I have them?
to set the committee?
I don't have them, but you may. You can.
Volunteers.
I serve on it for one.
I'll serve on it.
I'll serve on it.
Come on.
Right.
Dr. Conley, can I make a recommendation?
Certainly.
You say you have a very powerful lobbyist group that helps represent y'all. I would include them in that committee to help you rewrite it. They're very valuable in directions and helping you with that.
And I'll be honest with you, on my tongue and my cheek, and Lord knows, how could I say? I would like to maybe at some point maybe entertain Diane as a consultant. My tongue,
Motion just failed.
I said I would like to entertain it, but no, because not because Diane knows the history of this board,
are two things that she did, that she requested. One of those was, getting summary suspension powers back and Stan may know for one other thing, and it was having to do with dealing with people who were being adjudicated by the board.
Okay, but I mean, I don't,
That's
I mean,
all- that's
I
all
would
the
say it
things
was
that I'm
tongue in
aware
cheek,
of, but
you know, we don't.
I think the dental board is the only board, licensure board, that does not have summer suspension power.
Yeah,
So a dentist out there can be, except for the disabled dentist. If you have a dentist out there that is totally incompetent, harming the public, you cannot take temporary action pending a hearing. You just don't have that authority. That needs to be added to the dental practice act.
Actually, there's a lot of little things, you know, that we really need to clean up, you know, but we, I mean, and I'm talking, well, I'm gonna shut up.
You now have 4 volunteers
We are.
for the committee.
Who are the lobbyists for the board?
We do not have a lobby. I was gonna clarify that.
No, we don't, that MDA has been looking over, I would think, not for us, but for the dentists in the state of Mississippi, which is somewhat weak for us.
So the 4 members are?
That
Dr. Smith, Laura, Dr. Porter, and I believe it's Dr. Irons is the first volunteer. We have 4.
We have a motion with 4 members of the committee. Any further discussion?
I've got a question for Stan. Conflict of interest with MDA?
You're gonna have to speak up.
Is that a conflict of interest with MDA lobbyists? I'm just asking.
Yes and no. This board has to objectively enforce the Dental Practice Act without any influence by MDA or MDHA. Any else, under the Supreme Court decision, FTC, a professional trade organization should not be controlling any board. So while the MDA or MDHA may support legislation, the board really ought to push its own agenda.
Any other discussion? Voting, all in favor, form of the committee? Say aye. All opposed? So moved. Do we have any kind of time?
No, I don't, no, we can't, I don't, I mean,
So the committee will report back on their complete.
right.
Will that committee, when they find the results of it, that committee will bring it before the board to vote on?
So, you know, yes, and then they could either vote it up or vote it down, or leave it alone, or whatever they want to do. But the board still have 100%.
Well, I agree with you, said that back in the day, especially even when I did the dental board, that, it was not a triple blind, double blind, or single blind, exam. And if Dr. Fred knew your dad was a dentist, then you passed, you know, and I agree that probably a lot of people just by the color of their skin was not granted a license, but I don't see where,
It's not that.
you know, it's not that way now, and in that sense, that law probably protects us from getting bad dentists into Mississippi. And that might not be one that we might not wanna, change, because that
Well,
is protecting the public of Mississippi.
Well, my thing is, to add to that, my whole point was, if some of those dentists who are very successful in their practice today in other states, if they were in the delta where they was intended to go, the dental therapists or this workforce issue, which may not be a problem, so a double-edged sword, they created some of this problem we're talking about today. And that's my point I was trying to make about that. You know, so, you know, 'cause they didn't, I know for a fact, Mike, well, I won't call his name, I know he's from Cleveland, Mississippi, and another doctor from Ruleville, Mississippi, and I know we were college classmates, that's why I know this. And we all made a pact that we all gonna come back to Mississippi and work. But knock on wood, I was the only one out of that group that's back here in Mississippi, because I did pass the boards, you know. And I do know, and it was a known fact, among the dentists, black dentists back in the day, Mississippi only allowed 1 black to come into the state of Mississippi. I mean, if you go back, it's on record, how many minorities took the board, and how many passed it. And how many others, mainly other white, took it, which is basically 100% passed it.
proud to say we're not there.
No, we're not there now. No, no, like I say, I am the first to tell you that. I mean, you know, and I mean, I'm very pleased with the way ADEX took the exams and the double blind and the whole nine. So if a young person, a student, doctor, successfully passable, that was on them. I mean, regardless what school they went to.
Yeah, I'm just saying that that law probably protects us now.
All right, agenda item number 9.
Let me add one thing.
Go ahead, please.
The last time the board reviewed the bill of practice action